I had significant weakness and limited use of the left side of my body. It took 2 months of physical therapy to regain most of my strength and movement.
Dina Pearsall was only 41 when she had a stroke. Until that day, she was very athletic and stayed fit, so Dina thought she was in pretty good shape.
I was kind of floored to find out I was walking around with high blood pressure, and that led to the stroke.
About 1 in 3 adults in the United States has high blood pressure. But like Dina, many of them are unaware they have it.
It's very important to know your blood pressure. It's a vital sign, and if it's high, it can lead to heart attacks, strokes, and heart failure. Studies have shown that if you monitor your blood pressure, it can decrease your risk of getting those problems. So it's important to monitor it.
Dr. Annabelle Bogman is a leading cardiologist who specializes in women and heart disease. She believes that it's important to know what your blood pressure is so you can do something about it.
If a patient's blood pressure is less than 140/90, doctors feel that they can change that and lower it by just doing simple changes with lifestyle. And that includes increasing your physical activity, eating less salt, eating fruits that are high in potassium, monitor your blood pressure, and maintaining a good weight. When you monitor your blood pressure regularly, you can see the impact that these simple changes can decrease their blood pressure, which is very rewarding.
I do manage my blood pressure now with medication, lifestyle changes, and stress-reducing exercises. My biggest concern now is raising awareness. Heart disease is a silent killer and is also the leading cause of death for Americans.
To help spread the word, Dina became a Women Heart champion. Women Heart is a national support group that promotes awareness and support for women with heart disease.
I had a healthy lifestyle and I was walking around with undiagnosed high blood pressure. So I tell people you need to know your numbers and get tested.
I think everyone should get their blood pressure checked at their doctors at least once a year, but I do think that everyone should have a blood pressure monitor at home, just like everyone has a scale to monitor a healthy weight. Regardless of age, I think everyone should know their blood pressure.
Most home blood pressure monitors are easy to use, and many offer special features to help you manage your blood pressure more effectively.
I ask my patients to check their blood pressure at least once a week to make sure that it's under control. But I also like them to check it at different times during the day, especially in the morning when the blood pressure tends to be high. But I also want them to check it when they're having symptoms such as chest pain, shortness of breath, or a headache. This could sometimes mean that their blood pressure is high.
More than 50% of people with high blood pressure who monitor at home show an improvement in medication compliance and have better outcomes.
I got my home BP monitor shortly after I got out of the hospital after my stroke, and I check my blood pressure twice a week, and I have for the last 7 years.
My patients bring their readings for me to review, and the blood pressures that we get in the office along with these readings can help successfully manage their high blood pressure.
When monitoring your blood pressure at home, it's critical to use a monitor that provides accurate results like those from Omron Healthcare, which are clinically validated.
I recommend high-quality monitors that are accurate and easy to use. The cuff size is also important. If the cuff is too small, it could lead to incorrect readings.
Managing high blood pressure is vital to reducing your risk for heart disease and stroke.
I'm an ex-athlete. I exercised, I ate right. It never would have crossed my mind to use a home blood pressure monitor, much less own one. But you really have to be your own advocate. You have to guard against your own health. You have to get tested for your blood pressure, know your cholesterol, know your triglycerides. Those are 3 very important numbers to know.
To find out more about how you can better manage your blood pressure, go to trustyourheart.omron.com.